All right. Well, I want to thank everyone for joining us this afternoon. Now it's noon for our lunch and learn with the Rockbridge Area Community Services organization. They're going to help us discuss and figure out how to keep our mental health intact during these still unusual and challenging times, albeit maybe for different reasons. So we've got a few of the team members here from RACS. And I will turn it over with that to Kim Shaw, who's the executive director, to say a few words about the team.
Hi, thank you for joining us today for the Lunch and Learn. Since you're here, you are likely aware that May is recognized as Mental Health Awareness Month. That leads me to a question for you. Just a curiosity question. We're not coming back for it. There's no right or wrong answers. But I would appreciate it if you would type your answer in the chat box. And that question is, what comes to mind when you hear the term mental health? So I'm going to pause just for a couple of seconds and give you all time to maybe type in some answers again. No right or wrong. We're not coming back to it. Just would like to know. So as Crystal mentioned, my name is Kim Shaw, and I am the executive director at RACS, Rockbridge Area Community Services. We are affectionately known by most in the community as RACS. I'm excited that we get to share and provide some educational information with all of you today about mental health. Usually when lay people hear the term mental health, many go immediately to things such as schizophrenia, bipolar and personality disorders, suicidal ideations, the big ones, if you will. What you may not know is that everyday terms that most people use flippantly, such as OCD, depression, anxiety, ADHD, these are all also considered mental health issues. Any of these can be life-altering, both good and bad, and they can be debilitating. It's important to realize that mental health issues can be triggered by any number of things and at any time in a person's life. Mental health issues are, excuse me, non-discriminatory. They cross any boundary you can think of: age, race, religion, socioeconomic, and otherwise. This subject is so taboo and often stigmatized, and rarely do you hear anyone outside of those at a mental health organization that want to talk about it. The question would be why? And honestly, I think it's because it hits close to home for many of us. I know it does for me. I have a sister that suffers from both mental health and substance use issues. My stepmother, who has not historically suffered from any mental health issues, was diagnosed within the last 6 months with depression. And her depression is very debilitating when it strikes. She can't function for days on end. I personally had my own mental health episode, if you will, on Monday night. So to give you a little funny and look into my life, like many of you, I've gone from the stress of COVID restrictions to the stress of those restrictions being lifted. And I know that sounds crazy, but if you think about it, at this time last year, there was nothing. Everything was shut down. Everyone was staying home and fearful. We were just getting by, coping the best we knew how. So fast forward to this year, some semblance of normalcy, which also brings with it crazy sports schedules and puts my husband and I in divide and conquer mode. As you can imagine, I've had a lot going on in life, from the story I just told. I just kept smiling, kept pushing through, and I kept telling myself, I just need to get through this thing or that thing, and then I'll take time to recharge, because I work in the field, so I know that that's what I need to do, right? Well, one late practice too many, along with some doggy diarrhea, and I found myself standing in the middle of my mudroom at my wit's end on Monday night. It wasn't pretty, it wasn't funny, but at the end of the day, it happens. It's life, and it's nothing to be ashamed of. Thankfully, mine was just a moment in time, and one that I can laugh about now. Unfortunately, many who suffer from mental health issues never find themselves at a place that they can laugh about it, or even take time to thoughtfully reflect upon it, because they're busy living it. every day, day in and day out. And they often suffer in silence. Why do they suffer in silence? Because it's easier than the criticism that they fear they're going to face. Those who suffer feel marginalized. They know the stigma that comes with a diagnosis. They've heard the disparaging remarks made by people who don't understand mental health issues. Truth be told, they might have made some of those remarks. Some examples, they're just making that up. She just wants attention. He's just using that as an excuse. Because mental health issues can't be seen or touched, they're easier to dismiss. Even with the number of celebrities and everyday individuals that are having the conversations about mental health and the importance of mental wellness, those who suffer still feel marginalized and stigmatized. I recently read a statistic that mental health issues affect 25%, or 1 out of every 4 people. Take a second to process that number. That's huge. In another study that was also based around COVID and mental health, the percentage of adults who reported symptoms of depression or anxiety disorders rose from 11% in the time period of January through June of 2019 to 41.1% in January of 2021. Again, that is a massive increase. This past year has been challenging, and many who haven't typically faced mental health issues have found themselves struggling as these numbers support, while individuals who were already struggling are more stressed and needing additional supports. I would guarantee you that we will continue to deal with the lasting stressors created by COVID for the foreseeable future. So here at RACS, we're striving to eliminate stigmas, to support individuals on their journey to mental wellness. We want everyone to know and to understand that mental health issues are nothing to be ashamed of. With appropriate diagnosis and subsequent treatment, mental health can be managed. RACS provides a wide range of services with core focuses around mental health, substance use, developmental disabilities, and prevention. At our heart, we are an organization filled with caring, compassionate individuals who want to help others overcome barriers, whatever their barriers might be, real or imagined, that are keeping them from living the lives they have imagined for themselves. It's important for everyone participating today to understand that mental health issues are very real, but also very treatable. They should be part of the story, not the story itself. With proper supports and interventions, medication, therapy, or a combination of both, many people successfully live and manage mental health issues every day, just as one might manage high blood pressure or diabetes. My staff often hear me use the analogy of a raindrop hitting a puddle of water, and we want to be that first drop that starts the ripple of recovery and understanding for those that are suffering and those that need to help them. So again, I thank you for joining us today. I'm excited that you're taking part in this Lunch and Learn, because knowledge is often the first step and the key to understanding and acceptance. And with that, I'm going to turn you over to Greg Hornback, the Clinical Director for RACS, who's going to share more about why mental health matters.
Yeah, so as Kim said, we do want to thank you for joining us, taking your valuable time out of your lunch hour today and getting with us. And we're hoping that we not only give you some good practical information, but also some valuable information on how you can access services in this community and so on. So as we talk about mental health, we've already asked, what do you believe mental health is? We use that term a lot. We use it as a punchline. We use it in conversations. And of course, in this agency, we use it as a part of our work terminology constantly. So what does it mean when we talk about mental health? And at least to some degree, when you think about mental health, you think about your brain. Your brain is the most complex machine known to mankind. it's made up of nearly 100 billion nerve cells. That's hard to even imagine. That means you have as many neurons in your head as there are stars in our galaxy. There is a lot going on. Each of these connects and communicates to other nerve cells throughout our bodies, making up what we call our nervous system. So an interesting fact about that happening inside of your body, each of these connects and communicates, and there are more potential connections between the neurons in your body than there are subatomic atoms in the known universe. So that's hard to even imagine. So every little thing that takes place requires these neurons to communicate. So if you have a pen sitting at your desk nearby, pick it up just as an experiment and touch it to any part of your body. And if you really want to think about the way that communication travels, touch it to a part of your body far away from your brain. And an electrical signal is sent so that instantly, I mean simultaneously, when you touch any part of your body, your brain knows about it. So again, think about what that means. Every neuron between wherever you touched and when it communicates to your brain, instantly communicates. And an electrical signal is sent from one neuron to the next, to the next, to the next, and so on until your brain receives the message that something has touched you. But it's actually more impressive than that. You also know if it's a friendly touch. You know if it caused pain. You know if it caused pain, what level of pain. How does a neuron do all of that? Well, imagine a fire. What do you do if you have a house fire? You spray water on it, right? Obviously, yes. But what if it's an electrical fire? If you spray water on that, it's a whole different story. So what you spray on a fire causes it to behave differently. And this is true with your body as well. Each neuron secretes chemicals. It secretes different chemicals depending on what message it wants to send. Some cause more electrical stimulus. Some reduce or suppress electrical firings. This causes the firing of the nerve to respond differently, depending on what you need to know about the object that is touching you. So, with all of that information, take your pen again and touch your skin. Think about all that just had to happen for your brain to know that that pen touched your skin. Now add firing neurons connected with your sight, connected to your hearing, your smell. Now add emotions, which fire a different set of neurons. Now add memory. You have so much going on inside of your body at any given time. So no wonder I feel exhausted so much of the time. Even just sitting on the couch becomes a very physical activity if you're thinking about it. So all this is interesting, and to me, it's quite amazing. I like to study it, but why is it important? And it's important because thinking turns out to be a very physical activity. And what I mean by that, it's not done in the abstract like we used to think about. We used to think about mental activity as something that kind of happened almost spiritually, but it's a very physical thing that takes place inside of our bodies. And so much has to go on in our bodies for us to think straight or to have mental health. And with a thinking system so complex, you can imagine it doesn't take much to interfere or make it compromised. So we want to give, like I said, a piece of just realistic, good advice on how you take care of that. And this will seem simplistic, but it's not simple. The first piece of advice is to exercise. Yes, exercise is, as much of a letdown as that might be. I wish I could give you more of an aha moment, but more and more research is finding that there is a very strong connection between your physical health and your mental health. And it is one of the best things that you can do to prevent mental illness. And now actually multiple studies have begun showing actual reversal of some dementia patients who are exercising. So that is quite a breakthrough in the mental health field. We're starting to recognize that you not only can prevent some of the mental illnesses that we see in the elderly, but we're starting to see remission when they have added exercise. So again, I wish I had more of a aha moment for you. These three things and take this medicine, but turns out that exercise is one of the most important things that you can do for your mental health. So the second piece of practical advice is more about how you approach problems. And it is something that we try to teach our clients. It is practical for each of us, but again, more difficult than it sounds. So that piece of advice is this: each person should focus specifically and intentionally on what they can control. So I often say this is like driving a car. In the scheme of things, you control very little. There is still a lot out there that could happen, but you have to drive your car. So when you say control what you can, that is different than controlling every situation. I'm not asking you to become a control freak. I don't want you to control other people. I'm saying specifically, try not to think about the things that are out of your control. The trick is to figure out what those things are. So that becomes very hard if something seems personal. Seems like personal things should be in our control. The most common example of that is when people are victims of horrible things, sometimes victims subject to people that should love them, victims of people that are supposed to protect them. And so how do they take control? And again, I'm in no way saying that we should pretend that there are no victims. There certainly are. We hear horrible stories in this building all of the time. And actually, currently, I'm seeing a young woman who just a quick synopsis of her life. She was rejected by her mother. She was abused by her father. She has been sexually abused. She has attempted suicide. I promise you, she is a victim. But let's say that she's 97% victim. Like, that's a fairly high, if you were going to define how much of her life is victimhood. Let's say she's 97% victim. That means she has control over 3% of the things that happen in her life. And what she is finding is if she focuses on those 3%, it makes a difference, and she can actually make progress 3% at a time. And if you string that together for a few weeks, suddenly your life is 35% better. So these are a couple of real life things. You know, she's not controlling a huge amount of her life, but she is driving her car. So again, just to recap, one is a physical commitment and the other is a habit of how to look at things. But I promise you, if you and the people in your life will start to implement these little things, you'll see a difference in the clarity that you have when you're thinking. Memory becomes better. There's a lot of real life advantages to participating in these disciplines. So with that, I'm going to pass the conversation on to Tamara Bowling, and we can talk about ways to pursue the services that the agency has to offer.
Thank you. Welcome, everybody. My name is Tamara Bowling. I'm the Access Outpatient Administration Manager for RACS. So I'm going to explain to you a little bit about what the process looks like for an individual who might need to seek services at the CSB and kind of some of the outpatient ongoing services that we offer. So open access or same-day access is a statewide mandate for CSBs. It's designed to assist clients in obtaining needed services quickly and efficiently. So each CSB has kind of their own design for this, what that looks like, including different days, different times that they offer. Same-day access, Rockbridge CSB, same-day access is offered Monday through Thursday between the hours of 11 and 2. So what that means is simply that a person can walk into the building at Greenhouse Road Monday through Thursday between the hours of 11 and 2 and request what's called an intake assessment. So the process looks like they walk in, they complete what we call a financial meeting. That will happen first. And then what happens is they meet with a licensed or licensed eligible clinician to do the actual intake assessment. So this assessment determines needs and services. The assessment takes about an hour and it goes through a series of questions and information regarding mental health and substance use needs or concerns. Some people kind of come in with an idea of what's going on with them, and sometimes they don't, because sometimes, quite frankly, we don't know. So that's kind of what the assessment is designed to do, is help you or help someone to figure out what is going on and what maybe could I benefit from. So once the assessment is completed, the client will be tracked to begin services. So what this looks like depends on the services requested or recommended. So for example, if after an assessment, the clinician recommends to meet with a psychiatrist for medication management and case management, then a referral will be made to case management, and the individual will then be called by staff to schedule a follow-up MD intake to start medication management services. So if the client needs individual therapy services or substance use services, then they'll be referred to that area. I will say that due to full capacity in some of the services, there are a wait list for some services. If a client has to go on a wait list, they're notified. Clients are triaged according to risk level. So we absolutely try to get services started in a timely manner, but we do like to kind of be honest if we have a wait for a service. Another thing to mention too is that although the open access or the same day access is designed for a same day assessment, which is absolutely true, and an individual will get a same day assessment, it is not starting the services that day. So I think sometimes that gets a little confusing. So you will get an assessment, but you're not going to see an actual doctor to get medication that day. That will be scheduled following the assessment. So I just kind of wanted to put that out there also. Our outpatient team is currently made up of 5 clinicians. We have 1 open position. We have 1 clinician that does primarily play therapy and works with children and adolescents. The other 4 clinicians work mostly with adults, some adolescents, and assist with the substance use group treatment and mental health group treatment and individual therapy. We have a substance use case manager who helps with individuals who suffer from addiction. She provides assistance with helping them receive insurance if they need it, referrals to other community services, assistance with housing, childcare, any kind of other needs or concerns that they have. Our substance abuse case manager also assists with services at the jail. So due to COVID, that kind of obviously went non-face-to-face. And I think that as soon as they are able, they will bring that back face-to-face. But she does a lot of kind of correspondence right now with the clients in the jail. And typically pre-COVID, she would run groups there and see individuals on an individual basis. We also have a child crisis clinician who can see children and adolescents immediately. So for example, if a child or adolescent is experiencing a crisis, then they can be brought to Greenhouse Road and she can see them and work on resolving the crisis and then kind of building a bridge to further services. She also carries an outpatient ongoing caseload for individual therapy with children and adolescents. So outpatient mainly offers individual mental health therapy, substance use group treatments, and we are looking at starting our motivational enhancement therapy group, which is a mental health group back up. So hopefully we'll get that back up and running. We can provide individual substance use therapy if needed. This usually is geared towards adolescents. We offer couples counseling and some family counseling. We kind of try and gear it to the individual and their needs. We have a psychiatric services unit, which is the team that provides psychiatry and medication management. We have 1 full-time nurse practitioner, 2 part-time psychiatrists, and 3 full-time nurses. We offer a Suboxone program, and this is our medication assistance program for clients suffering from addiction to opioids. There is a criteria for the service. If someone is interested, then they simply talk to the intake clinician at that very beginning step, and then it gets staffed and services are offered that way. We also have some other medication assistance services such as injections. So CSPs are often referred to what we call a safety net for communities, particularly regarding mental health, substance use. We're typically known for serving low income, but we do serve everyone. So I think that sometimes that gets a little confusing on our process and who we serve, but we absolutely serve everyone. And again, like I said, sometimes an individual doesn't know what they need, and that first step is scary. So we want to be that safety net. There was a slide previous, I think, that had my information on there. I am absolutely always willing to be a point person, and we are here to help. So anytime you need to call with a question or concern, you are not sure where to go, maybe someone you know is not sure, I am more than willing to answer questions for anything and guide you in that process. So I'm now going to turn it over to Erica, who will give you an overview of some other services we have.
Okay, so I am Erica. I am the child and adolescent and adult case management supervisor, as well as the CIT coordinator here at the CSB. And I know that Tamara has explained a lot of services. Greg has talked about our services, and now I just want to take a little bit of time and talk about a few more services that we offer, but also just to answer questions that you guys might have. So first of all, kind of want to go back to what Greg was talking about and how we need to start equating behavioral health with medical health. So just like if someone had diabetes and their pancreas was failing, they may need to take medication for the entirety of their lives, but they may also need to watch their diet and exercise and meet with their doctor regularly. There may be just a variety of things that they need to do. It's the same for behavioral health. And so we need folks to understand that you can't just tell someone who has diabetes that they need to go out and sit in the sun and their pancreas will start working. Or if you just start having happier thoughts, then you'll start making insulin. That's just not how it works. And it's not how it works for folks who are suffering from mental health issues as well. You can't, we have folks who a lot of times tell us who are suffering from depression. People tell me, if I just think happy thoughts, I'll feel better. And that's just not how it works. So we want folks to understand that just like with medical health, with mental health and behavioral health, folks need to have a variety of different treatments. It may be individual therapy, it may be medication management, it may be just some short-term services. And I think a lot of times folks think about individual therapy and that it has to be an ongoing thing for years. And that's just not the case. Sometimes folks just need some individual crisis counseling, or folks maybe just need to take medications for a couple of months to kind of get over the hump. So when we're looking at those kinds of things, that's when we start looking at the different crisis intervention services that we have. But I also want to talk a little bit about our prevention services first. So some of you guys may know our prevention services department. We have lots of things that we do in the community in regards to drug and alcohol prevention, mainly in the schools. There are billboards kind of all over the community. There are ads on the radio. Some of the bigger things that we take part in, though, is our drug take back, which occurred a couple of weekends ago with through collaboration with the law enforcement offices, where they took back any unused medications that folks wanted to dispose of. There are also 2 coalitions that the Prevention Services Department oversees. That's RAPC, which is the Rockbridge Area Prevention Coalition for adults and business members in the community. And then there's SURFA, which is Students in Rockbridge Promoting Healthy Alternatives. And that's a youth coalition that's available to our students at Pierre McClure High School and Rockbridge County High School. Prevention also offers many different types of trainings. There's mental health first aid training, which is kind of like an introductory course for behavioral and mental health interventions. There's Revive, which is a course that teaches individuals how to administer Narcan in the event of an opiate overdose. We provide that to law enforcement agencies and the different life support and first aid agencies throughout the community. There's also ACEs, which is a trauma-informed care training to teach individuals how to interact with folks who have experienced trauma and just how to equate their trauma to kind of what they're doing currently and how that trauma may have impacted their lives. I also want to talk about our emergency services department, which is, like Tamara said, we have several mandated services and safety net services, and emergency services is one of those. First and foremost, we have our crisis hotline. That number will be displayed on our next slide, so we won't show you that just yet. Our crisis hotline, which is a 24-hour-a-day, 7-day-a-week hotline where individuals can call in the midst of a crisis, or family and friends can call for an individual who's in the midst of a crisis and speak to a trained clinician. They can talk to a person one-on-one about what's going on. And if that clinician feels that further care is needed, then they will contact the CSB on-call pre-screener to kind of talk that individual through the crisis at the time. We also have our short-term crisis counseling services, which is available for folks who are just, like it says, experiencing a short-term crisis. So like Tamara said, we do have a waiting list for several of our services, one of those being individual therapy. And so there are times where there are folks who need to talk to someone before they may actually get in for individual therapy with that long-term therapist. And so we provide crisis counseling. Folks can come in during office hours, tell our front office staff they need to talk to somebody for crisis counseling, and they'll see an emergency services clinician right then and there. The only caveat to that, however, is that we also in emergency services do pre-screenings for hospitalization. Now that's a conversation that would last much longer. And so I'm not going to get into that whole entire process. However, when I say that the caveat for the walk-in crisis is the hospitalization process, that is something that I wanted to address, because if we are dealing with a involuntary hospitalization that includes law enforcement and our local hospital, then that crisis counseling session may have to take a back seat. That's not to say that they won't be seen. That's just to say that they may have to sit in our waiting area for a little bit, not necessarily hours on end, but they may have to just sit and wait for a few minutes. So I talked about the pre-screening a little bit. And again, that's a huge conversation that would take many more hours. But what you do need to know is that we do have certified pre-screeners whose job is to assess an individual for hospitalization, for involuntary hospitalization. So if someone needs to go to be psychiatrically hospitalized, they can go straight to Carilion or Bath Community Hospital or any of our local hospitals and walk in and ask for voluntary hospitalization. However, if someone is in need of involuntary hospitalization and there has been an order issued for them to be assessed, that's where our pre-screeners come in, and they'll start to conduct that assessment and determine whether or not someone needs hospitalization. So I kind of want to move forward to our CIT, our crisis intervention team, because that's when we start talking about our collaboration with law enforcement. We have a crisis intervention team. It's composed of officers from Rockbridge, Buena Vista, Bath County, Lexington, BMI Police Department, Washington and Lee Security, hospital staff, behavioral health staff. It's this huge team and task force whose main goal is to provide education to those individuals who are going to respond in a crisis. So it's a division of our CSB, but it also is a collaborative effort through many other agencies. And CIT is an initiative that it exists around the world. So it started in Memphis, Tennessee. We use what's called the Memphis model. And the main goal is to help divert those individuals who are experiencing a mental health crisis to get them the help that they need instead of going to jail. So it's a jail diversion program. And one of the things that we do is we host 40-hour trainings. We have one in just a couple of weeks. And that's mainly composed of law enforcement officers, but we also include behavioral health staff and other individuals from different agencies. And we educate mainly law enforcement officers on how to respond during a mental health crisis. I think one of the biggest things that we talk about is that the skills that they learn during this training it's nothing new. It's just helping them to utilize those skills in a way that they can be effective and helping folks during a mental health crisis. Also providing them with a multitude of resources that we have in our community. A lot of folks say we're so small, we don't have all these resources. But then when you start to list them on paper, you see what all is available in our community, and it is really eye-opening. We also offer the opportunity for there just to be some conversation. I think that's one of the biggest things is it's helped with our networking, but also helped us to be able to have conversations about what we feel is working, what we feel isn't working, what we feel we need to do as a group to help individuals who are experiencing a mental health crisis. Along those lines, we also have the CIT assessment site. We aren't currently using our quote unquote real site currently because our real site is at the hospital. It's it's located in the basement of the hospital, but because of the pandemic, we haven't been utilizing that site. However, if there are individuals who are at need or at risk of hospitalization or who need to be assessed, law enforcement officers can bring them here to our building and we can assess them here at RACS. Thankfully, with the provision of telehealth services, we've been able to do a lot more things in emergency services. We're able to respond a lot quicker, which has been really, really helpful. We're able to communicate with officers a lot more easily. And it's been really helpful to be able to have our iPads and phones and all these telehealth services. So we're really thankful for that. And I want to let you know, I talked about the crisis hotline that we have. And on the next slide, you'll see that we have a lot of different numbers. I'm not going to go through all those because you guys can read, obviously, but I just want to show you several different numbers and resources that are available. I do want to point out the COPES warm line, the Virginia COPES. That is a hotline that was developed by the Department of Behavioral Health and Developmental Services for individuals who are just experiencing anxiety and stress related to COVID-19. So you can see the hours there that are available for folks to just call. There's the crisis hotline. You can see in the right column, it's a very short list of partners that we work with, but we work with so many other agencies and entities, but we just put the little short list there because we wanted to provide you with information for the health center, which also offers behavioral health services, but also medical and dental services. We are at a point now where we've had to start collaborating with the health center just really in depth because our waiting list has gotten so long. And so there are times where we may call the health center and say, hey, we've got some referrals for you because we just can't, we're not able to accommodate all those folks, and they're willing to take them on. There are times where the health center says, we really got somebody who's a little bit more difficult. Can you guys take them? Also Project Horizon, we refer to them a lot, especially in cases where individuals come in and they've experienced domestic violence or partner abuse, anything along those lines. The reason that we refer to them is because their services are free. They have counseling services. They have an adult counselor. They have a child play therapist. They have a lot of different services, and all of their services are free. So it's really been just a great resource for us to be able to utilize them. And again, they will call us if they have an individual who has much more significant mental health issues that they can't handle there. But then there are sometimes where we may have an individual who just has had some issues, just some infrequent issues, and we can pass them off to Project Horizon to engage in counseling if we know that we're going to have a waiting list. So I know there have been some questions, and I want to answer the questions. Our last slide is our information just for our agency. If you go to our website, which is listed there, you'll see so much more information. You'll get information about all the services that we offer. One of the things I want to point out too is that you've seen on a couple of our slides, I know I talked about prevention services, but you may see some of these yard signs around the community. Our prevention department partnered with just a couple of the people in the community, but they had these signs printed off, and they're available to folks if they want to put them in their own yards, in the on the lawns of their businesses, in the windows of their business. You can just contact Brianne Rogers and she can get those signs to you. Or I believe there are some days that we have available where folks can just come here and pick up a sign or two, but those are all free to the community as well. And we really just want these signs to be out so that folks know that we are all taking mental health seriously, and we want folks to know that they can, talk to us or talk to someone. Don't get so overwhelmed that they feel like they have no other option. So do we have any questions from anyone? Do we have any questions in the chat? I wasn't able to read the chat. Or
I'm
maybe
checking the chat right now.
I was gonna say, maybe I can't pull up the chat. Yeah, so if you would, if folks would like a copy of the slides, we would be happy to send them. Again, this presentation is going to be online. And Patty, I don't know what United Virginia is. I believe Kim is still on here and she might have a better understanding or a better knowledge of what United Virginia is and if we're participating with them. So I'm going to let Kim answer that.
So it is my understanding that United Virginia, that's something that's very new this year. They're trying to get that up and running. They hope to have that going across the state of Virginia by the end of the year, is my understanding. But we are not currently participating in that. It's a process to try and get community partners. So basically it's a way to do referrals across agencies without having the red tape, if you will. So we've looked into it, we've had the conversations, but we're not currently participating. And Patty, if there's something else that you're speaking of that then I don't know what it is, but I'd be happy to answer your question on here or offline, either way.
Kim, this is Crystal. What resources, if any, can you provide the business community specifically? I mean, the business owners themselves may have like individual things, but do you all come, like if they have all their employees together and want to have a presentation from you, is that something that you can do?
Well, sure. I mean, we would be willing to. We've never had a specific request for a presentation. We do lots of trainings. The prevention team does lots of trainings. Our prevention team locally and statewide has truly stepped up during COVID, and they've done amazing with their virtual presentations. And so they're always available to help with mental health first aid, youth or adult, the ACEs, any of those trainings. But yeah, depending upon what a business might need, I'm sure we could pull a team together that would be happy to come participate or, give a presentation.
Okay, that's great to know.
Yeah.
Does anyone else have any questions for the team at RACS? Feel free to unmute if you like. Okay. Well, I thank you all. This has been really helpful. I think it's offered some great insight into kind of how we see ourselves, and then definitely what you all can provide for the community. It's an invaluable resource. So we're glad that you all could join us today for this Lunch and Learn. As I said in the beginning, we did record the session. So as soon as I get it uploaded to YouTube, we will share it on our Facebook page. And I guess everyone have a great afternoon.
Thank you, Crystal, for having us and for hosting us.
Yes,
Thank
thank
you
you very
very
much.
Thanks so much.
Thank you very
Thank
much.
you. Take care.
Thanks.